Welcome back. In this video we will learn about dialysis, in particular hemodialysis. Let's first understand the term dialysis. What does it mean? The term dialysis is derived from the Greek word dia means through, and lysis means splitting. Dialysis is a form of renal replacement therapy. It is an artificial process to remove excess water, solutes, toxins. Dialysis is a life-saving procedure for patients with acute kidney injury, chronic kidney disease and drug overdose. At this point, you should be curious how dialysis occurs. What's the principle behind it? It works on the principle of diffusion of solutes that occurs through a semi-permeable membrane. Waste products from patients' blood, fluid diffuse into the dialysis fluid and then removed. Dialysis is of two types: hemodialysis and peritoneal dialysis. In this video we'll learn about hemodialysis in detail. Hemodialysis is an extracorporeal procedure that removes waste products, excess electrolytes and water from the blood. Why do we perform hemodialysis? Hemodialysis is performed to maintain fluids, electrolytes and acid-base balance in patients with AKI or CKD. Hemodialysis work on the principle of diffusion and ultrafiltration. Diffusion: movement of solutes across semi-permeable membrane for solute removal. Ultrafiltration, for fluid removal. Before moving on to how dialysis is performed, let's learn components of hemodialysis. First is the blood access, to obtain connection to patient's bloodstream. It can be done in three ways: catheter, short-term access, AV fistula, done with minor surgery, AV graft, done with minor surgery. The second component is blood pump, to draw blood from the patient and to maintain constant flow. Heparin pump, it add anticoagulants, heparin, to prevent blood clotting. 4. Dialyzer, it is the main component, called as artificial kidney, contains cylindrical bundle of semi-permeable membrane. One end is connected with the blood compartment and other with the dialysate. The fifth component is dialysate, also called as dialysis fluid, contains water, dextrose, electrolytes and bicarbonates. Other important components includes flow rates, air trap chamber, and sensor units. Let's understand how hemodialysis process occurs. First, access is made to patient's bloodstream through catheter or AV fistula or graft. Blood pump draws the blood from patient, usually at 300 to 500 milliliters per minute. Heparin pump adds heparin to prevent anticoagulation. Then blood enters the dialyzer. Dialyzer contains semi-permeable membrane that removes the solutes like urea, uric acid, creatinine into the dialysate by diffusion. In dialyzer, the flow of blood and dialysate is in opposite directions, called as countercurrent flow, that draws extra water, salt and fluids. The blood, after passing through the dialyzer, passed through air trap chamber and sensor unit that removes air bubbles from the clean blood that enters the venous line. This cycle continues for 3 to 4 hours until all the waste is removed and fluid overload is corrected. Types of hemodialysis based on how frequently it's performed. Conventional, done 3 times per week for 3 to 4 hours. Daily hemodialysis 6 days per week for 2 hours. Nocturnal hemodialysis 6 nights for 6 to 10 hours. With this we've completed this topic. That's all for now. Keep mastering, keep learning, only on Mastering Meds.